Hello, NCLEX aspirants. We always take feedback from our students who pass the exam to understand which questions were asked. After gathering feedback from 5,000 students who passed the NCLEX exam in the last 5 years, we've compiled these 4,500 frequently asked questions. These are the board's favorite picks. Are you ready to ace the NCLEX on your first try? Use our 30-33 strategy. In 30 days, watch 30 practice test videos. Watch each video 3 times. By following this method, you'll master 4,500 NCLEX practice questions and boost your chances of passing NCLEX on your first attempt.
After administering medications to her assigned patients, which client should the nurse prioritize for follow-up? A. The client taking mirtazapine who feels drowsy. B. The client taking citalopram who is experiencing nausea. C. The client taking flufenazine who has a fever. D. The client taking clonidine who feels dizzy when turning over in bed. The correct answer is C. The client taking flufenazine who has a fever. Flufenazine, an antipsychotic medication, can lead to neuroleptic malignant syndrome, a potentially fatal condition. Fever is a key symptom of neuroleptic malignant syndrome and requires immediate attention. Option A is incorrect because mirtazapine-induced drowsiness is an expected side effect, especially when taken at night. Option B is incorrect because citalopram may cause transient nausea, which typically improves with food or bedtime dosing. Option D is incorrect because clonidine can cause dizziness, which usually lessens after a few doses and is not immediately life-threatening. Great start! Prioritizing care is essential to ensuring patient safety. Let's keep the momentum going with the next question. A pregnant woman in her second trimester reports a dark line running down her abdomen. The nurse would recognize this as which condition? A. Melasma. B. Linea nigra. C. Chadwick's sign. D. Stretch marks. The correct answer is B. Linea nigra. This dark line is a common skin change during the second trimester and nothing to worry about. Option A is incorrect because melasma refers to facial pigmentation changes, not abdominal. Option C is incorrect because Chadwick's sign is the bluish discoloration of the cervix, not a skin change. Option D is incorrect because stretch marks, while common, are not linear hyperpigmentation like linea nigra. On to the next. Let's test your knowledge on managing pediatric clients with asthma. To alleviate discomfort during the night for a pediatric client recovering from a severe asthma attack, the nurse should recommend which sleeping position? A. Elevated head position. B. Lying face down. C. Lying on the side. D. Flat on the back. The correct answer is A. Elevated head position. Sleeping with an elevated head in a high or semi-Fowler's position can help prevent nocturnal asthma exacerbations by improving airway drainage. Option B is incorrect because prone positioning can increase the risk of nocturnal asthma symptoms. Option C is incorrect because side lying can restrict lung expansion and worsen asthma symptoms. Option D is incorrect because supine positioning can exacerbate asthma due to factors like gastroesophageal reflux. You're doing great! Let's switch gears to neonatal care. A neonatal nurse receives a report about an infant who is small for gestational age. What does this term mean? A. Weighs less than 6 pounds 3 ounces. B. Weighs below the 20th percentile. C. Weighs less than 4 pounds 1 ounce. D. Weighs below the 10th percentile. The correct answer is D. Weighs below the 10th percentile. Small for gestational age, SGA, refers to an infant whose weight is below the 10th percentile for their gestational age, indicating they are smaller than what is typical. Option A is incorrect because it describes low birth weight, not necessarily small for gestational age. Option B is incorrect because the 20th percentile is considered normal, not small. Option C is incorrect because it describes very low birth weight, VLBW, not necessarily small for gestational age. Great job! Now, let's move to a question about a critical test during pregnancy. When educating a client about a scheduled contraction stress test, what should the nurse explain? A. You will drink a solution with 50 grams of glucose. B. You might need to stimulate your nipples during the test. C. A positive result indicates no late decelerations in the baby's heart rate. D. A negative result means your baby had variable decelerations. The correct answer is B. You might need to stimulate your nipples during the test. Nipple stimulation can induce contractions during a contraction stress test, which helps assess how the baby will tolerate labor. Option A is incorrect because glucose consumption is related to glucose tolerance tests, not contraction stress tests. Option C is incorrect because a positive contraction stress test result indicates the presence of late decelerations, suggesting fetal distress. Option D is incorrect because a negative contraction stress test result indicates no late decelerations, which is a reassuring sign. On to the next challenge. Let's talk about labor induction. A client at 39 weeks gestation is about to receive oxytocin to induce labor. How will the nurse administer this medication? A. By intramuscular injection. B. Intravenously through the mainline infusion using an infusion pump. C. Intravenously via a secondary line using an infusion pump. D. Orally in a liquid form. The correct answer is C. Intravenously via a secondary line using an infusion pump. Oxytocin should be administered intravenously via a secondary line, piggyback, using an infusion pump to allow precise control over the infusion rate. Option A is incorrect because intramuscular administration is used for postpartum bleeding, not labor induction. Option B is incorrect because oxytocin should not be administered as a primary intravenous infusion due to its potency and the need for precise dosing. Option D is incorrect because oxytocin is not available in oral form as it is destroyed by the gastrointestinal tract. Nice work. Next, let's look at what happens after the delivery of a newborn. After delivering a newborn, which of the following physiological responses does not typically occur with the expulsion of the placenta? A. Decrease in progesterone levels. B. Decrease in estrogen levels. C. Increase in prolactin levels. D. Production of oxytocin. The correct answer is D. Production of oxytocin. Oxytocin production increases before and during labor, aiding in uterine contractions for placental expulsion. It continues to rise with breastfeeding, not just after placental expulsion. Option A is incorrect because the expulsion of the placenta triggers a decrease in progesterone levels. Option B is incorrect because the expulsion of the placenta triggers a decrease in estrogen levels. Option C is incorrect because a decrease in estrogen and progesterone levels allows for an increase in prolactin, promoting milk production. You're doing great. Let's move on to hearing loss in older adults. When caring for a client diagnosed with presbycusis, which intervention should the nurse prioritize? A. Provide reading materials with large print. B. Use an eye patch to cover one eye. C. Enhance food flavors with herbs and spices. D. Speak clearly near the better hearing ear. The correct answer is D. Speak clearly near the better hearing ear. Presbycusis, or age-related hearing loss, requires clear communication near the better hearing ear. Option A is incorrect because large print is relevant to visual impairments, not hearing loss. Option B is incorrect because eye patches are used for eye conditions, not hearing loss. Option C is incorrect because enhancing food flavors is related to taste impairments, not hearing loss. Now, let's test your knowledge on recognizing symptoms in a pediatric client with a bleeding disorder. A 10-year-old boy with hemophilia A presents with a prolonged episode of vomiting blood. What is the symptom called? A. Hemarthrosis. B. Epistaxis. C. Melena. D. Hematemesis. The correct answer is D. Hematemesis. Vomiting blood is termed hematemesis, a serious symptom in hemophilia that requires immediate attention. Option A is incorrect because joint bleeding is called hemarthrosis. Option B is incorrect because a nosebleed is called epistaxis. Option C is incorrect because black tar-like stools are known as melena. Next up, let's talk about post-operative care following hand surgery. In planning care for a client after hand arthroplasty, which intervention should the nurse avoid to prevent complications? A. Encourage finger and wrist exercises 10 times per hour using full range of motion. B. Keep personal items within reach of the non-operative hand. C. Elevate the operative arm on a pillow. D. Encourage the use of the non-operative hand. The correct answer is C. Elevate the operative arm on a pillow. Elevating the operative arm on a pillow can compress the ulnar nerve, which should be avoided post-surgery. Option A is incorrect because finger and wrist exercises help reduce edema and pain. Option B is incorrect because keeping items within reach of the non-operative hand promotes independence and safety. Option D is incorrect because using the non-operative hand helps with self-care and independence. Let's focus now on critical care with our next question. Which intensive care unit client should the nurse prioritize for immediate follow-up? A. A mechanically ventilated client not taking spontaneous breaths in assist control mode. B. A client with a flail chest reporting chest pain on inhalation. C. A client with gentle bubbling in the water, seal chamber of their chest tube when coughing. D. A client receiving intravenous dopamine via a peripheral intravenous line who reports pain at the intravenous site. The correct answer is D. A client receiving intravenous dopamine via a peripheral intravenous line who reports pain at the intravenous site. Dopamine, a vasopressor, can cause tissue damage if it extravasates. Immediate action is required to prevent severe complications. Option A is incorrect because assist control mode provides full airway support and lack of spontaneous breaths is expected. Option B is incorrect because pain with inhalation is an expected symptom of a flail chest. Option C is incorrect because gentle bubbling in the water seal chamber is normal during coughing. Great work! Next, let's explain a common chronic condition. How should the nurse explain psoriasis to a newly diagnosed client? A. It involves an overactive immune response attacking healthy skin cells. B. It is caused by a lack of T lymphocytes, leading to skin inflammation. C. It results from impaired production of skin pigment cells. D. It is due to excessive oil production clogging hair follicles. The correct answer is A. It involves an overactive immune response attacking healthy skin cells. Psoriasis is an autoimmune disorder where the immune system attacks healthy skin cells, causing rapid skin cell turnover and inflammation. Option B is incorrect because psoriasis involves overactive T cells, not a deficiency. Option C is incorrect because psoriasis is unrelated to melanocytes or skin pigmentation. Option D is incorrect because psoriasis is not caused by excessive oil production, which is characteristic of acne. Let's move on to post-operative spinal care with our next question. What should the nurse include in the care plan for a client after a lumbar laminectomy? A. Log roll the client to move them. B. Apply a cervical collar. C. Place an overhead trapeze on the bed. D. Keep the client in a high Fowler's position. The correct answer is A. Log roll the client to move them. Log rolling prevents twisting and maintains spinal alignment post-laminectomy. Option B is incorrect because a cervical collar is for neck injuries, not lumbar spine. Option C is incorrect because an overhead trapeze could strain the spine. Option D is incorrect because high Fowler's position puts pressure on the lumbar region. Low Fowler's is preferred. Let's shift focus to managing clients with esophageal varices. A client with chronic alcohol abuse and esophageal varices needs education to prevent variceal rupture. What advice should the nurse provide? A. Avoid lifting heavy objects. B. Do not walk briskly. C. Avoid using barbiturates. D. Refrain from taking antacids. The correct answer is A. Avoid lifting heavy objects. Lifting heavy objects increases abdominal pressure, risking variceal rupture. Option B is incorrect because walking briskly does not typically affect varices. Option C is incorrect because barbiturates are not specifically related to varices. Option D is incorrect because antacids are not contraindicated for varices. On to the next question about managing withdrawal symptoms. What medication does the nurse expect the physician to prescribe for a client with delirium tremens? A. Disulfiram. B. Naloxone. C. Methadone. D. Clonidine. The correct answer is D. Clonidine. Clonidine helps manage symptoms of delirium tremens by reducing blood pressure and agitation. Option A is incorrect because disulfiram is used for alcohol abstinence, not acute withdrawal. Option B is incorrect because naloxone treats opioid overdose, not alcohol withdrawal. Option C is incorrect because methadone is for opioid use disorder, not alcohol withdrawal. Finally, let's discuss a major risk factor in chronic respiratory conditions. When teaching about chronic obstructive pulmonary disease prevention, what should the nurse emphasize as a significant risk factor? A. Air pollution. B. Lung infections. C. Cigarette smoking. D. Asthma. The correct answer is C. Cigarette smoking. Cigarette smoking is the most significant risk factor for chronic obstructive pulmonary disease, causing extensive lung damage. Option A is incorrect because while pollution contributes to chronic obstructive pulmonary disease, it is not as impactful as smoking. Option B is incorrect because infections like tuberculosis can lead to chronic obstructive pulmonary disease, but are less common as a primary cause. Option D is incorrect because asthma can contribute to chronic obstructive pulmonary disease, but is not the primary cause. A client presents with suspected carbon monoxide poisoning. Which symptom is most likely? A. Low oxygen saturation levels. B. Restlessness and agitation. C. Slow heart rate. D. Headache. The correct answer is D. Headache. Headaches are a common early symptom of carbon monoxide poisoning due to its effect on oxygen delivery to the brain. Option A is incorrect because carbon monoxide poisoning does not typically affect oxygen saturation readings, which may appear normal. Option B is incorrect because carbon monoxide poisoning usually causes confusion and dizziness, not hyperarousal. Option C is incorrect because carbon monoxide poisoning often results in an increased heart rate, not a slow heart rate. When inserting a nasogastric tube for an elderly client, what is the correct sequence of steps? 1. Secure the nasogastric tube at the pre-measured mark. 2. Measure the tube length from the nose to the earlobe to the xiphoid process. 3. Encourage the client to swallow water while advancing the tube. 4. Insert the tube gently through the nostril towards the ear. 5. Lubricate the tube tip. The correct sequence is 2, 5, 4, 3, 1. This order ensures accurate and safe nasogastric tube placement. First, measure the tube length from the nose to the earlobe to the xiphoid process. Next, lubricate the tube tip for easier insertion. Then, insert the tube gently through the nostril towards the ear. Encourage the client to swallow water to help advance the tube. And finally, secure the tube at the pre-measured mark. Immediately post-operative following total hip replacement surgery, which assessment is the highest priority? A. Range of motion. B. Urinary output. C. Vital signs. D. Surgical incision. The correct answer is C. Vital signs. Monitoring vital signs is crucial to detect signs of shock or other complications immediately after surgery. Option A is incorrect because range of motion is assessed later in the recovery process. Option B is incorrect because while important, urine output is not as immediate a priority as vital signs. Option D is incorrect because the incision site can be assessed after ensuring the client's hemodynamic stability. For a client with a new prescription for sumatriptan, the nurse knows this medication is used to treat A. Peripheral artery disease. B. Severe high blood pressure. C. Migraine headaches. D. Chest pain. The correct answer is C. Migraine headaches. Sumatriptan is a medication used to treat acute migraine attacks by narrowing blood vessels around the brain. Option A is incorrect because sumatriptan is not used for peripheral artery disease. Option B is incorrect because sumatriptan is contraindicated in severe high blood pressure due to its blood vessel narrowing effects. Option D is incorrect because sumatriptan is contraindicated in chest pain, angina, due to the risk of coronary blood vessel spasms. A client is receiving continuous heparin and warfarin infusions. Based on laboratory results, what should the nurse do next? A. Discontinue the heparin infusion. B. Request a prescription for vitamin K. C. Withhold future warfarin doses. D. Record the results in the chart. The correct answer is A. Discontinue the heparin infusion. An excessively prolonged activated partial thromboplastin time indicates an over-anticoagulated state due to heparin. Heparin should be paused as it has a short half-life, and the nurse should follow up with the healthcare provider for further instructions. Option B is incorrect because vitamin K is not used to counteract heparin. Option C is incorrect because the international normalized ratio is therapeutic, and warfarin does not need to be withheld. Option D is incorrect because the prolonged activated partial thromboplastin time requires intervention, not just documentation. After a tonsillectomy, what is an appropriate intervention for a preschooler in pain? A. Allow the child privacy to avoid embarrassment from crying. B. Offer warm soup in the child's favorite cup. C. Place a magic blanket on the child to alleviate pain. D. Help the child develop pain coping skills. The correct answer is C. Place a magic blanket on the child to alleviate pain. Preschoolers often engage in magical thinking, and a magic blanket can be an effective pain management tool through distraction. Option A is incorrect because young children need the presence of caregivers for comfort, not privacy. Option B is incorrect because warm soup can irritate the throat after tonsillectomy. Option D is incorrect because preschoolers are too young to develop advanced coping skills for pain. A client with a peripheral intravenous line shows swelling and tenderness at the infusion site. What should the nurse do? A. Encourage the client to exercise the affected arm. B. Reposition the intravenous line and change the dressing. C. Lower the arm below heart level. D. Stop the infusion and remove the intravenous line. The correct answer is D. Stop the infusion and remove the intravenous line. Swelling and tenderness indicate infiltration. The intravenous should be stopped and removed to prevent further tissue damage. Option A is incorrect because exercise does not address the infiltration and can worsen swelling. Option B is incorrect because repositioning the intravenous line is not safe once infiltration has occurred. Option C is incorrect because elevating the arm helps reduce swelling, not lowering it. In the emergency department, which client needs immediate follow-up? A. Client using transdermal nitroglycerin for angina and reports a headache. B. Client on esmolol infusion for an abdominal aortic aneurysm, reporting flank pain. C. Client with discharge orders needing instructions for a fractured radius. D. Client receiving intravenous fluids for diabetic ketoacidosis with an order for insulin infusion. The correct answer is B. Client on esmolol infusion for an abdominal aortic aneurysm reporting flank pain. Flank pain in a client with an abdominal aortic aneurysm can indicate a life-threatening rupture requiring immediate attention. Option A is incorrect because headaches are a common side effect of nitroglycerin and not immediately life-threatening. Option C is incorrect because discharge instructions can wait compared to an acute, potentially fatal issue. Option D is incorrect because while insulin infusion is important, it is not as urgent as a potential aneurysm rupture. A client with infective endocarditis is likely to be prescribed which medication? A. Aspirin. B. Nitroglycerin. C. Vancomycin. D. Atorvastatin. The correct answer is C. Vancomycin. Vancomycin is a broad-spectrum antibiotic used to treat serious infections like infective endocarditis, pending culture results. Option A is incorrect because aspirin is used for its anti-inflammatory properties, not to treat infections. Option B is incorrect because nitroglycerin is for angina, not infection. Option D is incorrect because atorvastatin is a cholesterol-lowering drug, not an antibiotic. Which action does not reduce the risk of ventilator-acquired pneumonia? A. Elevating the head of the bed to 45 degrees. B. Collecting a culture specimen via tracheal suctioning. C. Providing oral care every 2 hours. D. Performing hand hygiene before and after suctioning. The correct answer is B. Collecting a culture specimen via tracheal suctioning. Collecting a culture helps diagnose, not prevent, pneumonia. Option A is incorrect because elevating the head reduces aspiration risk, a cause of ventilator-acquired pneumonia. Option C is incorrect because frequent oral care reduces bacterial load and ventilator-acquired pneumonia risk. Option D is incorrect because hand hygiene prevents infection transmission, including ventilator-acquired pneumonia. When inserting an indwelling urinary catheter in a male client, when should the nurse inflate the balloon? A. After advancing to the bifurcation point. B. Upon meeting resistance. C. After fully advancing the catheter length. D. As soon as urine appears in the tubing. The correct answer is A. After advancing to the bifurcation point. Inflating the balloon at the bifurcation point ensures it is in the bladder, not the urethra, preventing trauma. Option B is incorrect because inflating on resistance can cause urethral injury. Option C is incorrect because fully advancing the catheter is unnecessary and can cause discomfort. Option D is incorrect because urine appearance does not confirm correct placement. For a client with chronic obstructive pulmonary disease and abdominal pain, which vital sign needs follow-up? A. Blood pressure 133 over 76 millimeters of mercury. B. Respiratory rate 24 breaths per minute. C. Temperature of 101.1 degrees Fahrenheit or 38.4 degrees Celsius. D. Oxygen saturation 92% on room air. The correct answer is C. Temperature of 101.1 degrees Fahrenheit or 38.4 degrees Celsius. A high fever suggests an infection, which can exacerbate chronic obstructive pulmonary disease and requires prompt treatment. Option A is incorrect because the blood pressure is not immediately concerning. Option B is incorrect because a slightly elevated respiratory rate is expected in chronic obstructive pulmonary disease. Option D is incorrect because 92% oxygen saturation is typical for chronic obstructive pulmonary disease patients and not alarming. Which action by a new nurse caring for a tracheostomy client needs correction? A. Pre-oxygenating with 100% oxygen before suctioning. B. Suctioning with a twirling motion. C. Providing mouth care after suctioning. D. Inflating the tracheostomy cuff with 5 milliliters of air before suctioning. The correct answer is D. Inflating the tracheostomy cuff with 5 milliliters of air before suctioning. Inflating the cuff before suctioning is unnecessary and can cause trauma. The cuff should only be inflated to secure the tracheostomy and prevent aspiration, monitored with a manometer. Option A is incorrect because pre-oxygenation is essential to prevent low oxygen levels during suctioning. Option B is incorrect because suctioning with a twirling motion is appropriate. Option C is incorrect because mouth care helps prevent infection and is necessary after suctioning. By developing a unit-based counsel for decision-making, which leadership style is the nurse manager using? A. Transactional. B. Laissez-faire. C. Démocratique. D. Authoritative. The correct answer is C. Democratic. The democratic style involves staff in decision-making, fostering a collaborative environment. Option A is incorrect because transactional leadership is based on rewards and penalties, not collaborative decision-making. Option B is incorrect because laissez-faire leadership is hands-off, not participatory. Option D is incorrect because authoritative leadership involves central control, not shared decision-making. With severe intra-abdominal bleeding, what blood product will the nurse expect the provider to order? A. Fresh frozen plasma. B. Platelets. C. Granulocytes. D. Packed red blood cells. The correct answer is D. Packed red blood cells. Packed red blood cells are used to replace lost blood volume and treat hemorrhagic shock. Option A is incorrect because fresh frozen plasma treats coagulopathies, not acute blood loss. Option B is incorrect because platelets treat thrombocytopenia, not volume loss. Option C is incorrect because granulocytes are for severe infections, not bleeding. To maximize staff resources, which task should the charge nurse delegate to the licensed practical nurse or vocational nurse? A. Ambulate clients with mobility orders. B. Turn bed-bound clients every 2 hours. C. Perform wound care and dressing changes. D. collect routine vital signs. The correct answer is C. Perform wound care and dressing changes. Wound care and dressing changes are within the licensed practical nurse or vocational nurse's scope, freeing registered nurses for more complex tasks. Option A is incorrect because ambulation can be handled by unlicensed assistive personnel, allowing licensed practical nurses or vocational nurses to perform more skilled tasks. Option B is incorrect because turning clients can be delegated to unlicensed assistive personnel. Option D is incorrect because vital signs can be taken by unlicensed assistive personnel. In a client suspected of having trichomoniasis, what vaginal discharge should the nurse expect? A. White, cheesy discharge. B. No discharge. C. Malodorous, thin, yellow discharge. D. Grayish-white, foul-smelling discharge. The correct answer is C. Malodorous, thin, yellow discharge. Trichomoniasis causes a thin, yellow, malodorous discharge due to the protozoan infection. Option A is incorrect because a white, cheesy discharge indicates a yeast infection, candidiasis. Option B is incorrect because trichomoniasis typically involves discharge. Option D is incorrect because grayish-white discharge suggests bacterial vaginosis. After a total laryngectomy and tracheostomy, which finding needs immediate follow-up? A. Soreness at the incision site. B. Swollen stoma. C. Subcutaneous emphysema. D. Blood-tinged secretions. The correct answer is C. Subcutaneous emphysema. Subcutaneous emphysema indicates air leakage into tissue planes, which can spread and require immediate intervention. Option A is incorrect because soreness is a normal post-operative symptom. Option B is incorrect because swelling at the stoma site is common after surgery. Option D is incorrect because blood-tinged secretions are expected post-surgery. A client receives 1,300 units per hour of heparin from a solution of 25,000 units in 500 milliliters. How much fluid is infused in an 8-hour shift? A. 150 milliliters. B. 250 milliliters. C. 104 milliliters. D. 208 milliliters. The correct answer is D. 208 milliliters. To calculate, 1,300 units per hour divided by 25,000 units times 500 milliliters equals 26 milliliters per hour. Multiply by 8 hours, 26 milliliters per hour times 8 hours equals 208 milliliters. Immediately after total hip arthroplasty, which assessment is most critical? A. Urine output. B. Vital signs. C. Surgical site. D. Range of motion. The correct answer is B. Vital signs. Vital signs are essential for detecting post-operative complications like shock. Option A, urine output, is incorrect because while urine output is important, it is not the highest priority. Option C, surgical site, is incorrect because the surgical site can be assessed after ensuring hemodynamic stability. Option D, range of motion, is incorrect because range of motion is not a priority immediately post-operatively. A nurse needs to administer tiotropium bromide inhalation capsules to a patient with asthma. Which steps should be taken to ensure proper medication delivery? A. Use a nebulizer to administer the medication. B. Check the patient's blood glucose levels before and after administration. C. Advise the patient to take a quick, deep breath immediately. D. Ensure the patient holds their breath for 5 to 10 seconds after inhalation. The correct answer is D. Ensure the patient holds their breath for 5 to 10 seconds after inhalation. Holding the breath for 5 to 10 seconds after inhaling tiotropium bromide ensures the drug reaches deep into the lungs for optimal effect, enhancing absorption and efficacy. Option A, using a nebulizer, is incorrect because nebulizers are not used with tiotropium inhalation capsules. Option B, checking blood glucose levels, is incorrect because blood glucose monitoring is not necessary for tiotropium administration. Option C, advising a quick, deep breath, is incorrect because slow, deep inhalation is necessary rather than quick, deep breaths. A patient with trichotillomania is seen in the clinic. Which medication is the nurse likely to expect the healthcare provider to prescribe? A. Risperidone. B. Fluoxetine. C. Bupropion. D. Methylphenidate. The correct answer is B. Fluoxetine. Fluoxetine, a selective serotonin reuptake inhibitor, is often prescribed to manage the compulsive behaviors associated with trichotillomania. Option A, risperidone, is incorrect because risperidone is an antipsychotic, typically not used as a first-line treatment for trichotillomania. Option C, bupropion, is incorrect because bupropion, an atypical antidepressant, does not primarily target serotonin. Option D, methylphenidate, is incorrect because methylphenidate is used for attention deficit hyperactivity disorder and is not effective for trichotillomania. A nurse is caring for a client on aripiprazole. Which observation would indicate that the medication is effective? A. Absence of insomnia or nightmares. B. Improved concentration and focus. C. No hallucinations or delusions. D. Enhanced motor coordination. The correct answer is C. No hallucinations or delusions. Aripiprazole is an antipsychotic used for schizophrenia and mood disorders. An absence of hallucinations or delusions indicates the medication's effectiveness in controlling positive symptoms of schizophrenia. Option A, absence of insomnia or nightmares, is incorrect because aripiprazole is not primarily used for treating insomnia or nightmares. Option B, improved concentration and focus, is incorrect because improved concentration and focus are not primary indicators of aripiprazole's efficacy. Option D, enhanced motor coordination, is incorrect because enhanced motor coordination is not a direct therapeutic effect of aripiprazole. A nurse manager must decide on a nursing delivery system after a flood limits staffing to 2 nursing assistants and 1 licensed practical nurse. Which system should be chosen? A. Team nursing. B. Primary nursing. C. Functional nursing. D. Case management. The correct answer is C. Functional nursing. Functional nursing is suitable in this scenario, as it assigns specific tasks based on the caregiver's scope of practice. The nurse manager can manage medications, the licensed practical nurse can handle treatments, and the nursing assistants can provide basic care, ensuring all clients receive necessary care despite limited staff. Option A, team nursing, is incorrect because team nursing requires more registered nurses for collaborative care than are available. Option B, primary nursing, is incorrect because primary nursing involves continuous care by a registered nurse, which is not feasible here. Option D, case management, is incorrect because case management focuses on coordination by a registered nurse, which does not fit the current staffing limitations. In the emergency room, a nurse must prioritize care for multiple patients. Which patient should receive immediate attention? A. A 16-year-old female with the lower left quadrant pain for 3 days. B.
A 52-year-old male with dull right upper quadrant pain and a history of pancreatitis. C. A 20-year-old female with painful urination. D. A 30-year-old female 2 days post-cesarean section with a headache and leg swelling. The correct answer is D. A 30-year-old female 2 days post-cesarean section with a headache and leg swelling. This patient may be showing signs of preeclampsia, a serious condition requiring urgent intervention to prevent severe complications like seizures or stroke. Option A, lower left quadrant pain, is incorrect because the lower left quadrant pain, though concerning, is less critical than potential preeclampsia. Option B, right upper quadrant pain with a history of pancreatitis, is incorrect because the history of pancreatitis with right upper quadrant pain requires attention but is less urgent. Option C, painful urination, is incorrect because painful urination is serious but not an immediate emergency compared to preeclampsia symptoms. A nurse cares for a client with severe burns. Which intervention is best for preventing shock in this patient? A. Administering dopamine as prescribed. B. Infusing intravenous fluids as indicated. C. Using medical anti-shock trousers. D. Infusing fresh frozen plasma. The correct answer is B. Infusing intravenous fluids as indicated. Infusing intravenous fluids is the most effective intervention to prevent hypovolemic shock in burn patients, as burns cause significant fluid loss, and fluid replacement is critical for maintaining hemodynamic stability. Option A, administering dopamine, is incorrect because dopamine can help with blood pressure, but does not address fluid loss. Option C, using medical anti-shock trousers, is incorrect because medical anti-shock trousers are used in established shock, not as prevention. Option D, infusing fresh frozen plasma, is incorrect because fresh frozen plasma can aid in clotting but is not the primary intervention for preventing shock due to fluid loss. A child with severe dehydration from gastroenteritis is receiving IV fluids. What is the most reliable indicator of the child's response to treatment? A. Condition of mucous membranes. B. Current weight compared to admission weight. C. Number of stools in the pass shift. D. 24-hour urinary output. The correct answer is B. Current weight compared to admission weight. Weight is the most accurate measure of fluid status. An increase in weight reflects successful fluid replacement, as weight changes directly correlate with fluid gain or loss. Option A, the condition of mucous membranes, is incorrect because mucous membrane condition is subjective and less reliable. Option C, the number of stools, is incorrect because the number of stools does not accurately measure hydration status. Option D, 24-hour urinary output, is incorrect because urinary output helps but is less direct than weight in assessing overall fluid status. The nurse discusses identity development with parents of a struggling adolescent. Failure to develop a strong identity may lead to which outcome? A. Guilt. B. Inferiority. C. Shame. D. Role confusion. The correct answer is D. Role confusion. According to Erik Erikson, failure to resolve the identity versus role confusion crisis during adolescence results in role confusion. This developmental stage focuses on forming a personal identity. Option A, guilt, is incorrect because guilt is linked to the initiative versus guilt stage in preschoolers. Option B, inferiority, is incorrect because inferiority is tied to the industry versus inferiority stage in school-aged children. Option C, shame, is incorrect because shame is associated with the autonomy versus shame and doubt stage in toddlers. A client receiving total parenteral nutrition presents with certain symptoms. Which finding requires immediate nurse action? A. Blood glucose level of 400 milligrams per deciliter. B. Complaints of dry skin and thirst. C. A temperature of 37 degrees Celsius, 98.6 degrees Fahrenheit. D. Blood pressure of 124 over 78 millimeters of mercury. The correct answer is A. Blood glucose level of 400 milligrams per deciliter. A blood glucose level of 400 milligrams per deciliter is significantly high, indicating hyperglycemia, a common complication of total parenteral nutrition due to its high dextrose content. Immediate action is necessary to prevent severe hyperglycemia complications. Option B, complaints of dry skin and thirst, is incorrect because dry skin and thirst indicate dehydration, but are not immediate emergencies. Option C, a temperature of 37 degrees Celsius, is incorrect because a temperature of 37 degrees Celsius is normal and does not require urgent action. Option D, blood pressure of 124 over 78 millimeters of mercury, is incorrect because blood pressure of 124 over 78 millimeters of mercury is within normal limits. In preparing discharge instructions for a client with chronic diabetes insipidus, which statement by the client shows correct understanding? A. I need to log my daily fluid intake. B. I should increase salty snacks in my diet. C. I will need to drink no more than 700 milliliters per day. D. I will need to weigh myself at the same time every day. The correct answer is D. I will need to weigh myself at the same time every day. Daily weight monitoring is crucial for clients with chronic diabetes insipidus. It provides the best assessment of fluid balance, helping to detect any significant changes that might indicate dehydration or fluid overload. Option A, logging fluid intake, is incorrect because logging fluid intake alone is insufficient. Output must also be monitored for a complete picture. Option B, increasing salty snacks, is incorrect because increasing salty snacks can exacerbate hypernatremia, a concern in diabetes insipidus. Option C, limiting fluid intake to 700 milliliters per day, is incorrect because limiting fluid intake to 700 milliliters per day is inappropriate for diabetes insipidus. This might cause severe dehydration. Which over-the-counter medication is associated with Ray's syndrome, particularly in children recovering from viral infections? A. Brompheniramine/pseudoephedrine. B. Acetaminophen. C. Aspirin. D. Ibuprofen. The correct answer is C. Aspirin. Aspirin is linked to Ray's syndrome, a potentially fatal condition causing liver and brain damage, especially in children recovering from viral infections like influenza or chickenpox. Hence, aspirin is not recommended for children with viral illnesses. Option A, brompheniramine/pseudoephedrine, is incorrect because brompheniramine/pseudoephedrine is an antihistamine/decongestant combination not associated with Ray's syndrome. Option B, acetaminophen, is incorrect because acetaminophen is safe and not associated with Ray's syndrome. Option D, ibuprofen, is incorrect because ibuprofen has not been linked to Ray's syndrome. When assigning patients to a licensed practical nurse or vocational nurse, which client is most appropriate for their care? A. Client with sepsis requiring intravenous antibiotics and vasopressors. B. Client awaiting emergency surgery for acute compartment syndrome. C. Client with cystic fibrosis needing a sputum sample collection. D. Client with acute respiratory failure on high-flow oxygen. The correct answer is C. Client with cystic fibrosis needing a sputum sample collection. Collecting a sputum sample is within the licensed practical nurse or vocational nurse scope of practice. Cystic fibrosis is a chronic condition with predictable outcomes, suitable for licensed practical nurse or vocational nurse care. Option A, client with sepsis and vasopressors, is incorrect because the client with sepsis and vasopressors is critical and needs a registered nurse's expertise. Option B, client with acute compartment syndrome, is incorrect because the client with acute compartment syndrome is unstable and needs registered nurse care. Option D, client with acute respiratory failure, is incorrect because the client with acute respiratory failure is unstable and requires registered nurse oversight. What is the primary purpose of skin care and hygiene? A, maintain skin sterility and prevent infection. B, provide the client with comfort and well-being. C, protect the body's first line of defense. D, prevent bodily odors by eliminating bacteria. The correct answer is C, protect the body's first line of defense. The primary goal of skin care and hygiene is to protect the skin, which is the body's first line of defense against infection. Proper skin care maintains skin integrity and prevents infections. Option A, maintaining skin sterility, is incorrect because skin cannot be made sterile. It can only be cleaned to reduce bacterial load. Option B, providing comfort and well-being, is incorrect because while comfort and well-being are important, they are not the primary purpose. Option D, preventing body odor, is incorrect because preventing body odor is a secondary benefit of hygiene, not the primary goal. During a prenatal exam, the doctor observes a bluish discoloration of the cervix in a pregnant woman. The nurse would recognize this as which condition? A, linea nigra. B, melasma. C, Chadwick's sign. D, stretch marks. The correct answer is C, Chadwick's sign. Chadwick's sign is the bluish discoloration of the cervix, commonly seen in early pregnancy and typically observed by a healthcare provider during an exam. Option A, linea nigra, is incorrect because linea nigra is a dark line running down the abdomen, not a cervix change. Option B, melasma, is incorrect because melasma refers to facial pigmentation changes, not cervix discoloration. Option D, stretch marks, is incorrect because stretch marks are skin changes that do not involve discoloration of the cervix. A nurse is educating a client on how to administer Lispro insulin. When should the client inject this insulin? A, 1 hour after a meal. B, 30 to 45 minutes before a meal. C, 20 to 30 minutes before a meal. D, 5 to 10 minutes before a meal. The correct answer is D, 5 to 10 minutes before a meal. Lispro insulin is a rapid-acting insulin that should be administered 5 to 10 minutes before a meal to effectively manage postprandial blood glucose levels. Option A, B, and C are incorrect because these time frames are suitable for regular insulin, but not for rapid-acting Lispro insulin. After a left side cleft lip repair, how should the infant be positioned to ensure safety and promote healing? A, on the left side. B, prone. C, on their stomach. D, on the right side. The correct answer is D, on the right side. The infant should be placed on the right side to avoid putting pressure on the surgical site and to prevent aspiration by promoting drainage from the mouth. Option A, on the left side, is incorrect because placing the infant on the left side risks disturbing the surgical site. Option B, prone, is incorrect because prone positioning is not safe post-surgery. Option C, on their stomach, is incorrect because placing an infant on their stomach is unsafe due to the risk of sudden infant death syndrome. A nurse is caring for a 4-year-old recovering from abdominal surgery. Which activity should be prioritized? A. Peekaboo. B. Building blocks. C. Blowing bubbles. D. Playing with clay. The correct answer is C. Blowing bubbles. Blowing bubbles helps expand the lungs, reducing the risk of postoperative respiratory complications. This activity is fun and therapeutic, encouraging deep breathing. Option A, peekaboo. Option B, building blocks. And option D, playing with clay, are incorrect because they do not provide respiratory benefits crucial after abdominal surgery. Before administering cisplatin, what is the priority assessment for the nurse? A. Intravenous patency. B. Cancer staging. C. Hemoglobin and hematocrit. D. Sodium level. The correct answer is A. Intravenous patency. Intravenous patency is crucial before administering cisplatin to prevent severe tissue damage from extravasation. Ensuring a functional intravenous line is essential for safe drug administration. Option B, cancer staging. Option C, hemoglobin and hematocrit. And option D, sodium level, are incorrect because they are important, but secondary to ensuring intravenous patency for safe administration. A client with pulmonary edema is given bumetanide. Which symptom indicates an adverse response? A. Leg cramps. B. Increase in urine output. C. Distended neck veins. D. Adventitious lung sounds. The correct answer is A. Leg cramps. Leg cramps may indicate hypokalemia, a common adverse effect of bumetanide, a loop diuretic. Monitoring electrolyte levels is crucial when administering this medication. Option B, increase in urine output, is incorrect because increased urine output is a desired effect, not an adverse response. Option C, distended neck veins, and option D, adventitious lung sounds, are incorrect because they indicate fluid overload, not an adverse effect of bumetanide. While preparing a client for an MRI, which action by a student nurse requires correction? A. Asking if the client is claustrophobic. B. Moving a nitroglycerin patch to the back. C. Instructing the client to use earplugs. D. Informing the client about the absence of radiation exposure. The correct answer is B. Moving a nitroglycerin patch to the back. Nitroglycerin patches should be removed before an MRI due to the risk of burns from metallic components. Moving the patch is insufficient. It must be completely removed. Option A, asking about claustrophobia. Option C, suggesting earplugs. And option D, informing about no radiation exposure, are appropriate actions. An emergency department nurse treats a client on warfarin with an international normalized ratio of 5, reporting dizziness, black terry stools, and bloody gums. What blood product is anticipated? A. Fresh frozen plasma. B. Granulocytes. C. Platelets. D. Packed red blood cells. The correct answer is A. Fresh frozen plasma. Fresh frozen plasma provides clotting factors to counteract warfarin's effects and reduce bleeding risk, essential for a client with a high international normalized ratio and active bleeding. Option B, granulocytes, is incorrect because granulocytes are used for severe infections or neutropenia, not bleeding. Option C, platelets, is incorrect because platelets address thrombocytopenia, not warfarin-induced bleeding. Option D, packed red blood cells, is incorrect because packed red blood cells treat anemia, not coagulopathy. A child reports a wood chip in their eye. What action should the nurse take first? A, irrigate with hydrogen peroxide. B, perform a visual acuity examination. C, Apply a cold compress. D. Rub the eye until the object dislodges. The correct answer is B. Perform a visual acuity examination. A visual acuity examination is crucial to assess the extent of injury and vision impact before any other interventions. Option A is incorrect because hydrogen peroxide is not safe for eye irrigation. Option C is incorrect because a cold compress does not address the foreign object. Option D is incorrect because rubbing the eye can cause further damage. The nurse educates adolescents on human papillomavirus, HPV risks. Which condition is linked to human papillomavirus? A. Ovarian cancer. B. Pelvic inflammatory disease. C. Cervical cancer. D. Colon cancer. The correct answer is C. Cervical cancer. Human papillomavirus, HPV, is strongly associated with cervical cancer, and vaccination can prevent human papillomavirus-related cancers and genital warts. Option A is incorrect because ovarian cancer is not associated with human papillomavirus. Option B is incorrect because pelvic inflammatory disease is caused by different pathogens. Option D is incorrect because colon cancer is not linked to human papillomavirus. During emergency department ED triage, which client should be prioritized? A. Chronic pericarditis client with intermittent chest pain. B. Client with hemophilia, reporting joint stiffness and dizziness. C. Sinus pain radiating to the teeth. D. Chronic obstructive pulmonary disease, COPD, client with a productive cough. The correct answer is B. Client with hemophilia, reporting joint stiffness and dizziness. Hemophilia with joint stiffness and dizziness suggests internal bleeding, requiring immediate intervention to prevent severe complications. Option A is incorrect because intermittent chest pain in chronic pericarditis is less urgent. Option C is incorrect because sinus pain indicates rhinosinusitis, a lower acuity condition. Option D is incorrect because a productive cough in chronic obstructive pulmonary disease, COPD, is expected. A client asks about an herbal supplement for insomnia. Which should the nurse suggest discussing with their healthcare provider? A. Black cohosh. B. Raspberry leaf tea. C. Valerian root. D. Glucosamine. The correct answer is C. Valerian root. Valerian root is commonly used for insomnia, but may interact with medications, so clients should consult their healthcare provider before use. Option A is incorrect because black cohosh is used for menopausal symptoms. Option B is incorrect because raspberry leaf tea is not used for insomnia. Option D is incorrect because glucosamine supports joint health, not insomnia. A nurse is planning care for a post-bariatric surgery client. Which intervention should be included? A. Measuring abdominal girth. B. Placing the client on strict bed rest. C. Applying pneumatic compression devices. D. Inserting an indwelling urinary catheter. The correct answer is C. Applying pneumatic compression devices. Applying pneumatic compression devices helps prevent venous thromboembolism, a significant risk after bariatric surgery. Option A is incorrect because measuring abdominal girth is not relevant post-bariatric surgery. Option B is incorrect because strict bed rest raises pneumonia and thromboembolism risks. Option D is incorrect because indwelling catheters are not standard and can increase infection risk. A client with necrotizing pancreatitis is assessed. Which finding is expected? A. Hematuria. B. Hyperactive bowel sounds. C. Ecchymotic discoloration in the periumbilical region. D. Dysuria. The correct answer is C. Ecchymotic discoloration in the periumbilical region. ecchymotic discoloration around the umbilicus, known as Cullen's sign, indicates severe pancreatitis with bleeding into the peritoneum. Option A is incorrect because hematuria is not associated with pancreatitis. Option B is incorrect because bowel sounds are usually decreased, not hyperactive, in pancreatitis. Option D is incorrect because dysuria is not related to pancreatitis. A patient on the neuro floor may have autonomic dysreflexia. What should the nurse do first? A. Administer sublingual nitroglycerin. B. Elevate the head of the bed. C. Obtain a bladder scan for residual volume. D. Perform a digital rectal examination. The correct answer is B. Elevate the head of the bed. Elevating the head of the bed reduces blood pressure and helps manage autonomic dysreflexia, a medical emergency requiring prompt action to remove noxious stimuli. Option A is incorrect because nitroglycerin is secondary. The initial focus should be on non-pharmacological measures. Options C and D are important, but not the first step. Which medication is appropriate for treating a client with influenza? A. Valacyclovir. B. Azithromycin. C. Omeprazole. D. Oseltamivir. The correct answer is D. Oseltamivir. Oseltamivir is an antiviral effective against influenza, reducing symptom severity and duration if started within 48 hours of onset. Option A is incorrect because valacyclovir treats herpes, not influenza. Option B is incorrect because azithromycin is an antibiotic for bacterial infections. Option C is incorrect because omeprazole is a proton pump inhibitor for acid reflux, not influenza. Which client report requires immediate follow-up by a triage nurse? A. Abdominal cramping during peritoneal dialysis. B. Bilateral flank pain in a client with nephrostomy tubes. C. Facial edema in a client with nephrotic syndrome. D. Localized rash after ciprofloxacin for cystitis. The correct answer is B. Bilateral flank pain in a client with nephrostomy tubes. Bilateral flank pain in a client with nephrostomy tubes may indicate pyelonephritis, a serious infection requiring prompt treatment. Option A is incorrect because abdominal cramping can be managed by adjusting peritoneal dialysis flow. Option C is incorrect because facial edema in nephrotic syndrome is typical and less urgent. Option D is incorrect because a localized rash from ciprofloxacin is not immediately life-threatening. Which finding in a 24-hour postpartum client requires follow-up? A. Platelets, 85,000 per cubic millimeter. B. White blood cell count, 15,000 per cubic millimeter. C. Hematocrit, 46%. D. Creatinine, 1.0 milligrams per deciliter. The correct answer is A. Platelets, 85,000 per cubic millimeter. A platelet count of 85,000 per cubic millimeter is low and needs follow-up as it increases bleeding risk postpartum. Normal platelet count ranges from 150,000 to 400,000 per cubic millimeter. Option B is incorrect because a white blood cell count of 15,000 per cubic millimeter is high but normal postpartum. Option C is incorrect because hematocrit of 46% is within the normal postpartum range. Option D is incorrect because creatinine of 1.0 milligrams per deciliter is normal. A pediatric patient weighing 40 pounds needs ondansetron administered intravenously at a dosage of 0.15 milligrams per kilogram. The medication available is labeled as 2 milligrams per milliliter. How many milliliters should the nurse administer? Provide the answer rounded to the nearest tenth. A. 0.7 milliliters. B. 1.2 milliliters. C. 1.4 milliliters. D. 1.8 milliliters. The correct answer is C. 1.4 milliliters. To calculate the correct dosage, use the formula dose ordered to dose available times the volume of solution. First, convert the patient's weight from pounds to kilograms. 40 pounds divided by 2.2 equals 18.18 kilograms. Next, calculate the required dose, 0.15 milligrams per kilogram, times 18.18 kilograms equals 2.727 milligrams. Then, determine the volume to administer. 2.727 milligrams divided by 2 milligrams per milliliter equals 1.36325 milliliters. Finally, round the result to the nearest tenth. 1.36 milliliters approximately equals 1.4 milliliters. A nurse evaluates a woman who reports a positive result on a home pregnancy test. Which category does this finding belong to? A. Confirmatory sign of pregnancy. B. Indeterminate sign of pregnancy. C. Probable sign of pregnancy. D. Suggestive sign of pregnancy. The correct answer is C. Probable sign of pregnancy. A positive home pregnancy test is considered a probable sign of pregnancy due to the detection of human chorionic gonadotropin, HCG, which can also be elevated due to other conditions such as trophoblastic disease or recent miscarriage. Option A is incorrect because confirmatory signs include direct evidence of the fetus, such as ultrasound imaging or fetal heart sounds. Option B is incorrect because indeterminate is not a standard term used in categorizing pregnancy signs. Option D is incorrect because suggestive signs are more closely aligned with presumptive signs, which are based on symptoms reported by the patient and are not reliable indicators on their own. Among the following clients, which one requires the nurse's immediate attention? A. A client with acute glomerulonephritis and noticeable swelling around the eyes. B. A client who discarded their initial urine sample during a 24-hour urine collection. C. A client undergoing continuous bladder irrigation who feels the need to urinate. D. A client who reports dizziness after returning from hemodialysis. The correct answer is D. A client who reports dizziness after returning from hemodialysis. Dizziness post-hemodialysis can indicate hypotension due to fluid removal, which poses a risk of falls and requires immediate intervention. Option A is incorrect because periorbital edema is a common symptom of acute glomerulonephritis and typically does not require urgent action. Option B is incorrect because discarding the first urine sample in a 24-hour collection is standard procedure and does not necessitate follow-up. Option C is incorrect because the sensation of needing to urinate during continuous bladder irrigation is normal and not an emergency. A nurse is advising a mother on preventing asthma attacks in her 11-year-old child. Which statement by the mother shows she understands the teaching? A. Pets. Like dogs and cats are safe for my child. B. We can go skiing in the mountains. C. Swimming is a suitable exercise for my child. D. Cold weather improves asthma symptoms. The correct answer is C. Swimming is a suitable exercise for my child. Swimming is recommended for asthmatic children as it involves controlled breathing and moist air, which are less likely to trigger asthma. Option A is incorrect because pets with fur like dogs and cats can trigger asthma attacks due to dander. Option B is incorrect because cold weather activities like skiing can exacerbate asthma symptoms. Option D is incorrect because cold weather is known to trigger asthma symptoms rather than alleviate them. After a thoracentesis procedure, which complication is the nurse most vigilant for in the patient? A. Fluid accumulation in the pleural space. B. Lung infection. C. Blood clot in the lung. D. Collapsed lung. The correct answer is D. Collapsed lung. A pneumothorax or collapsed lung is the most common complication after thoracentesis, requiring the nurse to monitor for symptoms like rapid breathing, coughing, and decreased breath sounds on the affected side. Option A is incorrect because fluid accumulation, also known as pleural effusion, is not as common immediately after thoracentesis. Option B is incorrect because pneumonia is not directly associated with thoracentesis. Option C is incorrect because pulmonary embolism is not a typical complication of thoracentesis. Which food should a nurse advise a patient taking calcium channel blockers for hypertension to avoid? A. Eggs. B. Milk. C. Grapefruit. D. Bananas. The correct answer is C. Grapefruit. Grapefruit can increase the blood levels of calcium channel blockers, leading to toxicity due to inhibition of the enzyme CYP3A4, which metabolizes these medications. Option A is incorrect because eggs do not interact with calcium channel blockers. Option B is incorrect because milk does not interfere with the efficacy of calcium channel blockers. Option D is incorrect because bananas do not have a significant interaction with calcium channel blockers. When discussing Freud's psychosexual stages of development, which milestone is accurately associated with the anal stage? A. Recognition of self as separate from parents. B. Beginning of puberty. C. Learning to use the toilet. D. Forming emotional bonds. The correct answer is C. Learning to use the toilet. Toilet training is the primary focus during the anal stage of Freud's psychosexual development, where children derive pleasure from controlling bowel movements. Option A is incorrect because recognizing oneself as separate from the caregiver occurs later during the toddler years. Option B is incorrect because puberty marks the start of the genital stage in Freud's theory. Option D is incorrect because developing emotional relationships is emphasized in later stages, such as the phallic stage. A hospitalized client is prescribed chloral hydrate. The nurse includes which action in the plan of care? A. Monitor blood pressure every 4 hours. B. Clear a path to the bathroom at bedtime. C. Monitor apical heart rate every 2 hours. D. Instruct the client to call for ambulation assistance. The correct answer is D. Instruct the client to call for ambulation assistance. Chloral hydrate is a sedative, and the client may experience residual daytime sedation, so the nurse should instruct the client to call for ambulation assistance. Option A is incorrect because blood pressure changes are not significant with the use of this medication. Option B is incorrect because the client should call for assistance to the bathroom at night due to the risk of falling. Option C is incorrect because this medication does not affect cardiac function.